Welcome to Living and Learning with ADHD. I'm Kristen. I'm joined by Dr. Sally, and this was our most requested episode. So it's what to expect during an adult ADHD diagnosis. Now, even since I launched the channel 1 month ago, I've had at least 10 or 15 adults writing into me saying, I'm actually in the process of being diagnosed, or I'm about to go down that process. Can you give us some insight? So yes, that's what we're doing. We're here to help. So our first question is, what should we expect from the process?
Well, an assessment of ADHD is actually a very comprehensive and complex process. You're not going to walk into your psychiatrist and or your psychologist and be given the diagnosis in one session like you would if you went to a doctor for a medical problem. Right? What's most likely going to happen is you're going to need to attend several sessions and also complete several different types of questionnaires. Right, so the process is quite multi-layered. The first part will be making sure you find the right person to diagnose you. Now, there's a lot of professionals out there, specialists and allied health professionals. There's only two that in this country, in Australia, that are qualified to actually diagnose you. And those are, well, two types predominantly, the psychiatrist, okay, and a clinical psychologist. Now, when I say diagnose you, right, a specialist can probably do that as well, but they have to be kind of up here. Now, when I say up here, it means they need to have been trained in diagnosis and diagnostic assessment. Now, in this country, we have two different types of psychologists. We have a general psychologist and a clinical psychologist. Now, if you were going for, say, a disability pension, and you needed a diagnosis, a formal diagnosis of anything, Asperger's syndrome, autism, bipolar, post-traumatic stress, the only diagnosis that I guess like in this country Centrelink will take or will be from a psychiatrist or a neuroscientist or a clinical psychologist. And that's because a clinical psychologist is trained in diagnostic assessment, which means that we did subjects at university on how to use diagnostic measures like interviews and questionnaires, right, to validate somebody and then diagnose them accurately.
I did hear something anecdotally from a few adults a while ago, which was, that there are some practitioners who are saying they can diagnose over Skype, but they're just a general psychologist. And that's pretty concerning to me, that they're sort of marketing themselves as a specialist for ADHD or Asperger's or, high-functioning autism, and they're saying they can do that without actually seeing you, which
it's really important.
Yeah.
Right? It's really important. Unfortunately, there are many psychologists,
people who want to market themselves, I guess.
Psychologists and other allied health professionals. Not so much a psychiatrist would never do this because they'll lose their license, right? Who make out that they're qualified and trained and specialists in areas they're not. And even if you're looking if you've already got a diagnosis of ADHD and you're looking for a coach, I really recommend that whether you're being diagnostically assessed for the first time or you're getting someone to help you with therapy, that you thoroughly check out their credentials. Right, now you have every right to ask them, right, for a copy of their resume or what their credentials are. You can also go on their governing bodies like counselling, and over here we have something called the Australian Health Regulation Board, checking, right, or the psychology board or the medical board, checking the qualifications of the person that you've booked into. So number one, they need to have been trained in assessment, diagnostic assessment, and particularly with ADHD because there's such an overlap with bipolar disorder. There's a lot of brain imaging studies that show there's very small degrees of difference in the functioning of brain of someone with ADHD and bipolar. So you need to find somebody who knows what they're doing and has got a lot of clinical experience. So number one, do your research, right? Ask to speak to the practitioner. Psychiatrists probably won't do that, right? But a psychologist, a clinical psychologist should, right? You want to speak to them and ask them about, their experience or email them about their experience. So number one, it's about finding the right qualified practitioner. Now, what is usually the process is this, right? The first part of it is the most important and the most comprehensive. An interview. So you would normally participate in what we call a semi-structured or a structured interview where the clinician, whether it's myself, psychiatrist, somebody else, right, another clinical psychologist would want to know about everything about you developmentally, right? So going back through your history, your birth, your early childhood experiences, right, your experiences at primary school, your experiences with your mum, your family, your work experiences. So there'll be a full developmental history taken. Now within that, there'll be specific questions about how did you go at school? What were the subjects that you enjoyed? What did you not enjoy? What were your have you got any school reports that you can bring, academic records? So if you've got academic school reports from childhood, many of us past the age of 40 don't, right? They were little pieces of paper, weren't they? Nowadays they're great big, report cards that get emailed home to you, right? So for many of us, we won't have that information, but if you do, you'll be asked to take that with you. Okay, so the first part is probably the most daunting because you're going to walk into the office and you're going to not know what to expect. Anxiety is normal. I always think to myself, anyone who makes it through my door, I want to give them a medal because they've just stepped over the hardest step in the world, is to talk about your personal life and all about you. You're exposing yourself to someone who you don't know anything about.
Very brave.
So well done for those of you who have made that step forward to get
I almost want to do like the Hunger Games, we're standing with you in solidarity. You got this. Yeah.
So like I said, like if you have an opportunity to speak in person if you're going down the route of a clinical psychologist, if you have a chance to speak to them, I really recommend you do. So you get a feel. You get a feel for that person, whether you're going to gel, you're going to feel comfortable with them, right? Because you are discussing your life history. So there will be that part of it, okay, where you have to go backwards. And a semi-structured interview is also involving specific questions about ADHD, right? How do you go with, completing day-to-day tasks? Like home chores, getting the kids to school. There'll be specific questions that are loaded to look at, whether or not you fit the criteria.
So you're kind of just almost stitching the criteria into the questions.
Yeah.
That's amazing.
Right, so that's the way I do it. I follow interview, and then within that I use what I will call open-ended questions that are really about, for example, we know within inattentive ADHD, like often girls particularly with that condition, will have a dislike intensely, not all of them, for mathematics, right? They'll struggle with numbers.
I do.
Right? And they could even have something like dyscalculia, right? Which is...
That's me. I didn't realise that was so common.
Yeah, it's very common because mathematics is that side of the brain that's all about logic, it's all about numbers, it's all about, spreadsheets. And this is like serious attention to detail stuff.
Yeah.
All right, so a lot of girls will have trouble with that. Boys not always, but often you'll find with boys, right, that they'll have difficulty with reading. Right, because reading is like focus, attention, on this tiny little font, obviously. So the questions will be, what do you like doing? What did you like about school? What did you not like about school? So often the girls will go like they love singing, dancing, drama, but they dislike maths. So we're looking for those little key factors that we know support the diagnosis.
And as a teacher, I feel like dyslexia gets picked up, but very, very rarely dyspraxia.
Yeah. So there's co-occurring, there's little signals, right? That are outside the criteria that give us us as a clinician a good insight into, how long and the diagnosis can only be made if these symptoms or these characteristics have been present before the age of 12. Okay, so they'll be asking. That's why there's a lot of emphasis on your childhood experiences at school. How did you go with exams? How did you go with assignments? There'll be questions like that. So there's a big part of it, right? The most important part is this, background history and initial interview, clinical interview with you that's looking at that. Now, on top of that, right, you will be asked to complete a set of questionnaires. Now, there are standardized, validated, what we call questionnaires. Now, these questionnaires are known scientifically to be accurate in picking up symptoms of ADHD and breaks them down into the 3 different subtypes. So we know like the Connors rating scale, right, is a very well-known one. He's also got a diagnostic interview, and we know that Brown, a guy called Brown ADHD scale also. So there's a couple of questionnaires you'll probably be able to fill out. Now they're checklists, where you have to go, do you find it difficult to complete tasks? Always, sometimes, or never, sometimes, often, always, and you circle it, right? So there are a lot of self-report questionnaires, right? That will be part of it. They're called rating scales. Another one that you may get asked to complete is called the brief, and that's an assessment of cognitive function, of like the function of the frontal lobe. So you'll be asked to fill out those. Now, so there's the interview and there's the questionnaires. As an adult, right, the diagnosis cannot be made without a secondary person to support it.
An informant,
right? So they'll ask you, a spouse, a sibling, a parent, someone
Partner,
anybody who can vouch, and they will be, sometimes they're interviewed separately, okay, and they will also be asked to fill out questionnaires, okay, that will ask their opinion of your behaviour.
And it's really important that you choose someone who's supportive. So I have had adults reach out to me and be like, should we automatically take our parents because they've seen us since birth? Not necessarily, depending on whether they're supportive of the idea of you having ADHD or not. Some parents, I hear anecdotally, are quite defensive, and they don't want to kind of feel like they've contributed to anything, and so they might feel quite guilty or quite upset at the thought of doing that. So in some cases, perhaps a supportive friend or a partner might be more appropriate.
Yeah, so
everyone's different. Yeah,
so be selective in who you choose to be that person. It'll be the person you feel knows you well, right? And obviously, right, you'll get a sense, right, intuitively that you trust them.
Yeah.
Okay, and they've got your back. So, but you will be asked for somebody else's opinion. They won't make the diagnosis without that. And you can imagine, right, the reason I think the diagnostic process has become quite strict is because Ritalin is a street drug, right? So, unfortunately, right?
It's so frustrating because
stimulants have a street value.
Yeah, I remember talking to this guy out at the uni, and I think when I got to know him a bit better, I kind of anecdotally mentioned that I had ADHD and I took Ritalin, and I was when you go from liking a person to just, I hate your guts, because they say something that's just a complete clanger, and you just go, I can't believe you just said that. And he's like, oh yeah, I actually buy them off a chick so I can study. And I'm just like, do you have any idea how hard it is and how many hoops we have to jump through just to get a really small therapeutic dose, And I feel like people like you make it so much harder for people like us who are trying to do the right thing and who are genuinely struggling. And you're taking it to get an unfair advantage where we're just taking it to have a fighting chance,
Don't get me started.
Don't even get me. We're actually starting a segment called "Don't Even Get Me Started on This." Yeah, and this is going to be one of those things, because it just infuriates me. And even if you change a doctor or a pharmacist, they're like so careful around these kind of things, and you feel like going, hey, I've been on medication for 15 years. I've got no history of, drug abuse or anything like that. Like I'm pretty much as square as they come. I might have like one glass of scotch a week or something, like I'm wild, obviously.
So that's basically right. What's involved with the diagnostic process. So it's quite, sometimes it can take a good 6 sessions. So you're looking at paying out some good money. Yeah. Right. Because I really emphasize, right, a good psychiatrist. Now, the other thing is that part of the assessment process, diagnostic process, is what we call a differential diagnosis, right? So we have been trained with like a decision tree. Does this person have this and this? Can this be explained by something else? So a really good psychiatrist, if you don't have any in your area that specialise in ADHD as such, go for the top psychiatrist in your area.
Yeah.
All right, go to your doctor. So the first point of call, to get the referral to the psychiatrist, you will need, in this country, you have to go to your GP first. Right, so the GP will then refer you to the specialist. Now, of course, every GP is going to have their preferred specialist.
Yeah.
And in our little place on the Sunshine Coast here, we have old school doctors with old school psychiatrist friends, and those friends might not be the ones who've got the latest upload on ADHD, so you really need to do your own research first.
Definitely, in all the adults that I'm speaking to online, I'm encouraging them to kind of ask around in their local area, get online, look at forums and so on. We were just looking for someone in California, and we looked on the Attitude magazine website. It's really great. They have a really excellent, particularly if you're in America, they have a really great ADHD directory, and so you can look up firstly by state, and then you can go to the city. So for example, if you're in California and you're in, say, I don't know, San Diego, you could then look up the specialists in ADHD in that area. So I think a tool like that is really, really helpful. Absolutely.
Yeah, so do your research, right? Look around, right? Ask around, right? Or go to your doctor and find out, or just Google local psychiatrists, right? And find out, you know, the ones out there that have been, who know their stuff
Who specialise in ADHD, I think is particularly important.
But that might be hard to find, right?
Yeah,
So a really good psychiatrist, you might pay extra, but I believe you pay for what you get.
And also, the other question that I had, sorry to interrupt.
No, I haven't finished yet. Oh, let me just come finish.
Yeah, of course. Go for it,
right.
go for it.
So I need to finish, right? So that's really important. Now, the other thing, we've talked about the interview. We've talked about the background history. We've talked about the questionnaires. The biggest thing that we will be looking for in our sessions is your own presentation of the symptoms in the interview. Because if you have ADHD, right, you've got it or you don't. So you can't just turn off your hyperactivity, right, when you go to the shrink. Right, you can't sit there and not move. You have to move.
Yeah.
You know, I would be expecting like my client to interrupt me, talk over the top of me, probably tell me that they know more than me. Right, there's lots of little keys, right, that come out in the interview that give me. I see right there and then, right, a person's presentation. So it's not something you can fake. And it's not something you can hide. That's the key thing about ADHD. Bipolar is often, like confused with ADHD, but we know that ADHD tends to be an anxiety, biological condition. So these symptoms of interrupting, impulsivity, they tend to be there always. Right, whereas bipolar is known to be a mood disorder, so it's your moods that fluctuate more. So that's how they differentiate it. But so that's a couple of things that you can expect. It does take some time, and it can be a bit frustrating for us with impulse control issues, right, and patience issues. But it's worth paying the extra money, getting a good, well-established psychiatrist, clinical psychologist, so you can have peace of heart knowing that you either do or you don't.
Or you don't, yeah.
Okay.
Exactly. And my final question... No, I'm not interrupting you.
I had to finish, it's late in the day.
Who else could possibly put up with me filming videos for 3 hours other than this lady? The other question I had was, because I remember you were saying about paying the big dollars and things like that.
Yeah.
If people absolutely can't, because I do speak to a couple who say, they can't hold down a job, they may be homeless or just kind of crashing on a friend's couch and not have a lot of money. I mean, here in Australia, we have a mental health plan. Can they see a psychiatrist under that and be either bulk billed or pay a small gap? Like, does that happen for diagnosis as well as just normal therapy? Because I know you can for normal therapy, but I wasn't sure if you could for the diagnostic process.
Okay, so that's a really great question, Kristen. Really good question. So a lot of people don't have the money to fork out and go and see a private psychiatrist. In this country, that's our system. We have a couple of pathways. Number one is we have a community centre, the Adult Mental Health Centre. Right, so if you're down and out and you're struggling, you haven't got a job, right, you can self-refer, in fact, right? Now they have got a waiting list and they only take the most challenging cases because, but there are other areas in our community, of your community, don't know what it's like in America and other countries, right, where you have community services. So what might happen is if you were to go to adult mental health, right, because you had lots of problems with like not getting a job and you were being out not hold down job or money or over addictions, then as part of that intake process you may then get referred to the psychiatrist who then could possibly diagnose you with ADHD.
That's really, really good.
All right, so that's one pathway. The other pathway is to go to your doctor and get a mental health plan referral. This is in Australia, to see a psychologist. Now that referral might be for something else like anxiety, right, substance abuse, a secondary, because we know that the comorbidity is really high. So, that way, and part of our, that mental health plan initiative is that you are then allowed, right, to donate, so use 2 of those sessions, you get 10 sessions, and not every psychologist will bulk bill you either. There'll be a gap there, but it might be not as much as the...
Might be like $30 or $40
yeah, it might not be as much as the psychiatrist.
Yeah.
And that is to do an assessment.
Oh, that's so cool.
Right, so, but again, right, 2 sessions is only like the ice.
Yeah, the tip of the iceberg,
but it's
isn't
a start.
it? Mm-hmm.
All right, so it's a start to get yourself on that diagnostic process pathway.
And please, we can't, I guess, specify for each country individually, but if you do know the process, we're always happy to hear more information and help out more people around the world.
So what your psychiatrist is going to be looking for, right, is impairment. Okay, so you can have lots of these symptoms, but you must have a history. They'll be looking at, changes in jobs, right? Change of job, change of partners, lots of changes and ups and downs in your life because of the characteristics and symptoms of ADHD. All right, so we'd expect difficulties like with completing tasks like we talked about, and getting to work on time, organisation difficulties. So that's what they're going to be looking for, some key ways of which these symptoms. Now, number one, do you have enough? Do you have the 6 in each category? Or one category or both categories? Do you have enough symptoms? If you do have enough symptoms, do these symptoms impact on your daily functioning? Interpersonally and personally, your job and your career, your relationships? And if they do, then they'll look at the severity of your ADHD. And only after you've done all of that will you then talk about treatment or intervention. Now, we know that a lot of people manage their ADHD wonderfully, like the famous people that manage it well, and there's a lot of people that just normal day-to-day people, ordinary people who are holding down jobs, having
just our beautiful shiny ADHD brain community. We talk to you all the time.
Staying happily married, but it just means being open and honest and communicating to the people around you on how they can help you and how they can understand you. So I hope that has been helpful.
So helpful. Thank you, Dr. Sally. We look forward to hearing from you on our Discord chat room and our Facebook page. Thanks a lot. See you later.
Bye.